So you're treating more and more migraines in your practice.
Yeah. Oh boy, I tell you, migraines are a thing that's very difficult to treat because there's so many different causes and different types of headaches. And a lot of people lump it into migraine headaches. And typically, the typical patient I see, let me tell you, they see a neurologist or they see their primary care doctor. They try a bunch of meds and a bunch of therapies. And a lot of times those work.
Okay.
But there is a huge subset of people that have jumped through all of those hoops and continue to live with persistent daily headaches. And those are patients that are in our wheelhouse. And we can do a couple of unique things. Believe it or not, Botox is helpful.
Okay.
People do it, for wrinkles on their forehead, but it can also be quite helpful
headaches.
for migraine headaches. There's nerve blocks that can be done. There are these nerves on the back of the head called occipital nerves, but basically they cause this type of headache that comes up over the head. We can take you under X-ray and inject some medicine to try to turn those nerves off. There's different types of
and that works.
Oh, it tends to work quite well. If we can find the nerve that's involved and block it, it tends to work. There are different types of intravenous infusions of all sorts of medicines that we can try. And we do some things at our clinic in terms of an infusion of medicine that isn't necessarily done in a lot of other places in Dayton. One example is a medicine called ketamine that has been used to treat headaches, and that's something that we've done. And
so for some people, it really works.
For some people, it's quite helpful. And now there's a whole new class of medicines. They got a funny name to them. They're called Cgrp. Some scientists, I don't know, they named it. But this has been the first new medicine to treat migraines in about a generation, about 15 or 20 years. And those have provided some exciting opportunities. The bottom line is there's a lot of new things out there to treat migraine headaches. And there's a lot of things that we could offer a patient that's suffering from.
And because insurance covers it, it doesn't cost more to go to an interventional pain management physician.
That's correct.
Do you have a bias? I mean, do you think that everybody should at least, if you're in chronic pain, you should probably ask your doctor or just look for an interventional pain doc? Is that fair to say? Is that what you believe?
Totally believe, and I agree with that.
Because you work with all the spine surgeons, neurosurgeons. It's like, I mean, you refer to each other.
Correct. We're all on the same team. Our goal is to get that patient better and get them the relief that they need, regardless of who's doing it or what. But look, if you're suffering from pain, come see a pain specialist.
Especially migraines.
Yeah.
Because most people aren't going to guys like you for migraines.
That's right.
Right?
Yeah. And there are some new options out there, right? And sometimes taking a different perspective or looking at it differently is helpful. Just like if you take your car to two mechanics, the second mechanic may look under the hood and see something different. I mean, that's an advantage of seeing someone like me.
So have you seen people that have had migraines for 10 years, 5 years, and they're diminished?
Oh, yeah. And that's
because I know they're debilitating. I know a woman says 4 days out of the month she can't even function.
That's right. Because in particular, especially the things that we do that are unique or new or different than what they have tried before, those patients tend to respond quite well.
Do you have clinical trials?
Oh,
Any
yeah,
special
all the
stuff?
time.
Because you have a research place.
That's right. We're continuously doing research on migraine headaches. We're actually doing a study right now.
So people
using
can get in on that study?
That's right.
Okay.
Yeah.
And things that aren't even available elsewhere.
Correct.
Is that right?
That's correct.